The conflict in Sennar state erupted on the 26th of June when armed clashes began between the Sudanese armed forces and the rapid support forces in Jebel Moya in Sennar state. In the last 1 month, we've seen that conflict has spread to multiple localities within Sennar state, including Sinja, Adindar, and other localities, and it has led to large scale displacement. From the displacement tracking matrix, we've seen that over 136,000 people have been displaced from various locations across Sennar state. And the direction of the displacement, most people are moving east towards the neighboring state of Gadaref. Others are fleeing onwards to Kassala, Red Sea, and others going to River Nile and the Blue and White Nile states. These large movements are really having a heavy impact on the receiving states. The influx of people is straining local resources and infrastructure in the neighboring states that are receiving these displaced people. There are concerns about the poor living conditions and potential disease outbreaks in the sites that are hosting the displaced populations, especially with the start of the rainy season, which we are currently starting. The risk of waterborne and vector-borne diseases increases. There is a lack of basic water and sanitation facilities, and no running water or ablution facilities means a high risk of waterborne diseases.
Given the situation that you described, what are the primary obstacles in providing humanitarian aid and some of the challenges that you have come across?
The biggest challenge at the moment is the ongoing conflict and insecurity. The fighting continues to affect various regions of the country, including Sennar State, which we just talked about, but also multiple states in the Darfur region, as well as the Kordofans. This means that key supply routes have been cut off due to the fighting. Additional challenges are border closures and the weather conditions. So the Adre crossing from Chad is closed, and then the Chad to Darfur crossing via Tine in North Darfur is inaccessible or rapidly becoming inaccessible due to the heavy rains and flooding brought about by the rainy season. Finally, despite some recent improvements in visa approvals and travel permits for humanitarians, we still continue to see a challenge from bureaucratic and administrative processes. They continue to slow the pace of aid operations.
So, how is Mercy Corps adapting its assistance strategies given the challenges in delivering aid?
Well, our work at Mercy Corps is focused on providing immediate assistance to displaced communities, particularly through multi-purpose cash assistance. Cash assistance allows families to address a wide range of needs whilst also helping to support the viability of local markets in the face of the ongoing conflict. And with multi-purpose cash assistance, we can deliver the assistance by working in partnerships with financial service providers in the local markets. So we're able to deliver assistance quite rapidly and don't have to face some of the challenges associated with roadblocks and so on. We are also working with private sector companies to enhance access to agricultural inputs and financial services for farmers. So working with entities who are already present in the localities that we're targeting to be able to deliver assistance via the local market system.
I gather it must have been challenging to see what was happening on the ground. What did you take away from it?
With each passing day, Lenore, the lives of the Sudanese people are getting worse. The humanitarian situation is really worsening. The crisis in Sudan is one of the largest crises that the world has seen over the last few years. 50% of the Sudanese population is in need of humanitarian assistance, so that's approximately 25 million people. 755,000 people are at risk of starvation in the next few months, and we need more attention to this crisis. We need the work of humanitarians to be facilitated. We need more funding as well to reach more people with the assistance that they need.